Don't just give your pets a treat to cover up bad breath. That stench is likely a sign of more serious problems, and it could shorten their life.
Yeah, February is National Pet Dental Health Month, so it's a perfect time to think about having your pet's teeth cleaned. But the thought of having your pet go under anesthesia often causes people to put this procedure off. That is why Dr. Turi Norman is here with her team to tell us about an alternative. You are the co-founder of the Well Animal Institute. Tell us a little bit about the Institute first, and then we'll talk about the cleaning.
Okay, thank you. Thank you for having us here
Sure.
today. Our company, Well Animal Institute, we travel up and down the Front Range doing anesthesia-free teeth cleaning for dogs and cats. So we believe that frequent teeth cleaning is very important for the animal's health, and we don't want people to put it off because they're afraid of the cost or afraid of putting their dogs and cats under anesthesia. So we're very passionate about what we do, and we're doing our best to provide a safe, healthy, affordable option for people.
Okay, so you brought a pet in today. This is your tech. Tell people her name and the dog's name.
This is Janice.
Hi, Janice. And your pet's name?
Kate, is it Kada?
Caden.
Caden. And what is she doing today?
Well, what she's doing is she's, with a sterile instrument, is removing the plaque and tartar from the tooth and under the gum line. So after she's done that, she has a dental probe, and she'll probe the gums and check for health or disease, which might show up in the form of recession or pockets. She's going to check all the teeth.
So this sounds like a very thorough cleaning that you're
Yes,
able to do.
it
And
is.
clearly, Caden, the doggy here, is awake and aware of what's happening. Is she sedated at all with anything? Or
We give them some flower essences. We
Okay.
usually use Bach flower essences, so it's very similar to Rescue Remedy. And with cats, we just rub it on their ear, and dogs, we just give them a little
nice.
drink of it.
and it just helps them kind of calm down a little
It
bit.
helps them calm down. I took some before this commercial.
They're spraying it, they're sharing it all around. Yeah, because when I came up, I thought this was a stuffed animal. Because I'm thinking that the mouth is open, she's doing something, it couldn't possibly be a real dog, right? I mean, I've just never seen anything like this.
Well, it's a wonderful option for people. Now, if we find disease, though, or we find loose teeth, we will turn your animal down and refer you back to your veterinarian to have that taken care of.
Right.
Okay.
But we'll go through the mouth, and then we'll chart all our findings, and we'll give a copy of our dental report card to the pet owner. We'll go over all our findings. There's always veterinary supervision. The vet is always there. If we feel we need to dispense antibiotics for any reasons, we can do that right there on the premises.
So you kind of have a backup plan because you don't know what you're going to get when you
don't
open their
always,
mouths, right?
You don't always. Sometimes you have dogs with very thick tartar, and until you take that off, you're not quite sure what's going to be under there. So a lot of times we'll have people wait and say, let's just check and make sure we can do the mouth. And then if it's go ahead, then we'll take the animal back to the work area. We'll lay him down on a soft bed like this. Small dogs we can wrap in a towel, like cats. And then we just do the procedure. It takes between 30 and 50 minutes, depending on how much tartar there is to remove. And then we go over our findings with the owner. And, you know, it's great. The dog gets up, shakes, wags his tail, and walks out the door. And like nothing happened.
That's incredible. That's so different from the routine that I take my dogs through. They always have to go under anesthesia, and they get their teeth cleaned. And then when I bring them home, you know, it's kind of sad to see them coming out. I mean, it's hard on them, that anesthesia. It's tough on them.
It can be.
But look at, you know, we're looking at some befores and afters.
Yeah, look at the difference.
This is the cleaning that you're able to do. You're able to make that kind of a difference on a procedure just like this that she's doing.
Oh, absolutely, yeah. And the techs they're very well trained. They can get in there and they can get around all the teeth and all the hard to get to areas. They're very good at what they do.
Should all pet owners consider this? Is there a pet owner who shouldn't consider this?
Well, when you come in, the veterinarian will evaluate whether your dog is a good candidate for this procedure. And like I said before, we can turn them down if we find, you know, advanced disease or loose teeth in the mouth. But otherwise, I would say most animals are good candidates. They all do surprisingly well. If for any reason they don't, we just stop the procedure and we just let them go home. But we're constantly monitoring their stress level. We think that small dogs, because they have such crowded teeth in their mouth, and cats should have it twice a year, every 6 months, and we can keep ahead of what's going on in there.
Yeah, I feel like my two, they're dachshunds, so they're small dogs. They're only 20 pounds each. But one of my dogs, Red, he has a little heart murmur.
Yes.
And he is prone to seizures. Can animals like that do better with this type of procedure instead of going under anesthesia?
Well, of course, you've taken the risk of anesthesia out of it, so there's that. It's safer. And I can always do antibiotics if I feel the heart murmur. You know, we don't want bacteria to get into the bloodstream and go cause issues. And that's the reason for this whole procedure is periodontal disease. We don't want periodontal disease because not only can it cause pain and loss of teeth and infection in the mouth, but that bacteria can get into the bloodstream and travel around and lodge in susceptible areas. Yeah.
Incredible.
So it's all about prevention.
I'm so impressed.
I know, I am too. I'm like,
this dog is just lying there letting her do
buddy.
this. Beautiful. Well, if you are interested in anesthesia-free pet dental cleaning with the Well Animal Institute, the best way to get started is to check the calendar on their website and find out when they're going to be in your area. So visit wellanimalinsitute.com, and you can also call them at 303-654-0560. Very impressive.
Thank you.
Oh, and for February, we're having a discount.
Oh, wonderful.
So if you mention this commercial or you go to our website, we have a coupon for $15 off.
Well, thank you. So
Perfect.
definitely mention Colorado's Best.
Thanks
Thank
for
you so
doing
much.
that. Well, coming up on